Have you been told you'll need surgery for your Crohn's disease or ulcerative colitis? If so, you probably have a lot of questions as to how you even got to that stage. Believe me, I've been there, but stick around, I'll explain all to you as when surgery is absolutely necessary if you have Crohn's disease or ulcerative colitis. Welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information, so make sure you hit that subscribe button and the bell to be notified every time I post a video, as well as if you want to join the exclusive community of people who receive my personal tips and tricks on living with Crohn's disease, then make sure you sign up to my newsletter by hitting the link in the description box below. Now, if you need surgery or have been told by your doctors that you need surgery, do not be surprised because at least 80% of people who have Crohn's disease will need to have surgery because of it. I myself have had about 3 operations for strictures, and not all operations for IBD are major, as it will depend on the type of operation you're having and how severe the problem is that they're trying to rectify. So your stay in hospital for recovery can range from a day to a number of weeks. So when is surgery actually necessary if you have Crohn's disease or ulcerative colitis? The most obvious one is when it's an emergency situation. With Crohn's disease and ulcerative colitis, complications such as bowel obstructions, perforations, which means that there's a tear in your intestines, which can sometimes be caused by an obstruction, or if you have serious bleeding. You'll most likely go into hospital through A&E because you would be in a lot of pain and be very unwell if you have any of those complications that I mentioned. And so surgery is necessary then to save your life. One very serious complication of IBD is something called toxic megacolon. Although this is very rare, it is a very serious and life-threatening situation, and it's where your large intestine, also known as your colon, is unable to get rid of gas or feces because, for example, a blockage occurs and so makes your large intestines expand, dilates, distends, causing it to burst. Now that does sound very painful, and obviously that is a very serious situation, especially because this causes all the contents of your colon, so the bacteria and the fecal matter, to pour out into the space of your abdomen, which can cause infection, which can be very life-threatening. You will no doubt need surgery for this, and surgery for this can be life-saving. Now next, if you're like me and have suffered with strictures, then you'll know all about this, but if you don't know what a stricture is, basically it's a narrowing in your intestine. So usually your intestines have a lumen like this where food can pass through, but a stricture means that the narrowing of that is going smaller, causing pain when food tries to pass through it. Now this narrowing can be caused by inflammation and scarring of your intestine, and depending on how bad the stricture is, will depend on the type of operation you may have. If you are not responding that well to medication or nutritional treatment, then you may also need surgery to remove the diseased portion of your intestine. Depending on how much of your intestine and which part of your intestines has the disease will also depend on the type of operation and whether or not you may need a stoma created. Having complications such as abscesses and fistulas because of your IBD can increase your chances of needing an operation. So an abscess is a collection of pus that has built up within a tissue. So it's like a boil or a spot, but much more serious and can cause you to be in excruciating pain and feel very ill. For these, you may need a procedure so you can get it lanced or even drained to make sure it fully heals. Now, a fistula is an abnormal channel that links 2 parts together. So a fistula can actually connect your bowel to your bowel, or your bowel to another organ in your body or to your skin, and there are many different types of operations that are available for fistulas. So for example, you can have a ceton inserted or have a fistulotomy, a mucosal advancement flap procedure, but the main aim of all of these procedures is to treat the fistula and improve your overall health. Now you know why surgery may be necessary or if you have Crohn's disease, but what about the types of surgery that are available for Crohn's disease? Well, I've done a separate video on that which looks like this, so make sure you hit the link in the description box below to watch that. And while you're doing that, make sure you check out these videos for more useful tips, tricks and information on Crohn's and colitis. Hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment if you enjoyed this and found it useful. And I can't wait to see you all in the next episode.